Researchers are always studying new treatments and therapies for breast cancer, and in recent years, several new exciting targeted drugs have been approved with promising results. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. This week, we're talking about new and innovative treatments for early-stage breast cancer and the special clinic St. Luke's offers its patients. With me today is Dr. Whitney Hensing, a breast oncologist at St. Luke's Cancer Institute. Thank you so much for joining us.
Thanks for having me.
So first of all, Dr. Hensing, are there any new clinical trials that have come out recently for breast cancer patients?
Yes, for early stage hormone receptor positive breast cancer, there are several using gene expression profiles to help determine the chemotherapy benefit. So the RxPonder and TAILOR-X trials came out and showed that patients who have low genomic risk, even with high clinical risk features, can safely forgo chemotherapy.
Wow. Okay, so what does that mean for the average patient?
So we used to offer chemotherapy to everyone to reduce their risk of recurrence, but we found with this new genomic risk testing, we can safely forgo chemotherapy for the majority of patients, which really reduces their treatment side effects.
That's fantastic. Are there any newly approved drugs for breast cancer?
Yes, in the early stage setting, there were two new targeted drugs approved. One is Verzenio, which is added to endocrine therapy, and that was from the Monarch-E study, and another is olaparib from the Olympia study. And the Monarch-E study was really the first of its kind to show that adding a targeted treatment like Verzenio to endocrine therapy could improve disease-free survival. And it's an option for patients who have high-risk breast cancer that spread to the lymph node, and it's given with endocrine therapy for 2 years.
That's great. So what about new technology? What's St. Luke's using to help treat breast cancer patients?
So at St. Luke's North, surgeons are using the Molly device, which is a wireless localization technology. Traditionally, patients have an external wire that they have to wear up until the surgery, but with this, patients can live a more normal life, and it also can help surgeons do a more precise surgery, which leads to a better surgical and cosmetic outcome.
Fantastic, and much more convenient.
Yes.
So for the past 5 years, St. Luke's has had an affiliation with Washington University in St. Louis. Can you explain what that means for our patients?
Our partnership with Washington University really gives us an opportunity to have a lot more clinical trials that we can offer to patients. And that's important because it means our patients have access to therapies that are not yet approved. And it also, having a wide array of trials means we can find the best fit for the patient.
Fantastic. St. Luke's has a unique multidisciplinary clinic. Can you explain how it works and how it benefits patients?
Yeah, it's like a one-stop shop for patients, so they can meet with all of the different disciplines. So they meet with the breast surgeon, the medical oncologist, and the radiation oncologist all in one visit, and they leave with a comprehensive plan that everybody agrees on. It's really convenient for the patient because these visits are usually spread out over weeks, and it helps patients get to their treatment faster.
Great. Well, is there a final message you'd like to end on today?
Yeah, it's a really exciting time for breast cancer. There's been a lot of new approvals in the last year, really both expanding options for patients with higher risk disease and also peeling back for patients who don't need such aggressive treatments.
Great. Well, thank you again for joining us.
Yeah, thank you for having me.
To learn more about St. Luke's comprehensive care and advanced treatment options, visit stlukeskc.org/breastcancer. You can also stay up to date with all the latest health news and stories from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.